Dr. Marshall is Associate Professor of Epidemiology at the Brown School of Medicine, and it's a thrill to have him here. He was part of the scientific team when he was working on his doctorate, his dissertation, from the University of British Columbia. He actually worked on the scientific team that did the evaluation of Insight, which was the first supervised injection facility in North America, and he's really published. He published one of the most widely cited articles demonstrating its benefits in reducing overdose mortality, and we are delighted to have you here. Thank you.
Thank you so much. I'm glad I could make it. So as Dr. Friedman mentioned, I moved to Rhode Island in 2012. Before then, I had the privilege of working on the scientific evaluation of North America's first supervised injection facility, Insight. It opened in 2003 and has served thousands of people since. So what I'm going to do today is take you through what supervised injection facilities are, what they do, the kinds of services they provide, and then just summarize some of the evidence from our evaluation demonstrating increased uptake of addiction treatment, and importantly, preventing overdose. So supervised injection facilities, or sometimes referred to as safe injection facilities, which is what's on the slide. I prefer the term supervised because that's really at the heart of what they are. These are medical clinics where people can use drugs under supervision of medical professionals, usually nurses or doctors. In the case of Insight, the entrance is here. It is a facility for people who inject illicit drugs, primarily heroin. But there are over 100 around the world now in 66 cities, in Canada, Western Europe, and Australia primarily. In some of those facilities, people can use drugs through other means than injection, and so in those instances, you might refer to them as supervised consumption facilities or supervised consumption spaces. In Vancouver, Canada, yes, thank you. I'll talk about why supervision is important and how that prevents overdose, and I'll talk about the other services that are provided a little bit later. This is the entrance to the facility in Vancouver called Insight. I really like this photo because it has a couple of things that I wanted to highlight. The first, here's the entrance that you saw in the previous slide. This is in the downtown east side neighborhood of Vancouver, a very impoverished neighborhood with a lot of socioeconomic vulnerabilities, high levels of homelessness, also a strong and vibrant history of activism and advocacy amongst people who use drugs, and that was really in large parcel why this facility was opened. But you see right in front of the facility a police cruiser. So in order to make these interventions happen, they need to open, usually with exemptions from often federal drug possession laws. And that is the case in Vancouver. There is a constitutional exemption that provides basically exemptions to those laws to people who are using drugs in the facility itself, and also protects staff who may be working there and who may be liable under some of those federal laws. And also, in order for their success, you really need the support of local law enforcement. So for example, in Vancouver, the Vancouver Police Department has a policy. If they see someone injecting a public in an alley in Vancouver in the downtown east side, rather than arresting that person or asking them to move along, they actually escort them to the facility where a warm handoff takes place, and that person then can use the service and can benefit from the medical care and services that are provided. The other thing I like about this photo is what's on the second and third floor. There is actually a transitional housing program and treatment facility located directly above the injecting room, and a lot of people don't know that. So in this instance, people can actually be referred directly from the injection room to a treatment program upstairs, and that's called On-Site, and has been very successful at referring people to treatment and helping people who use the facility eventually lead long-term healthy lives. So this is the inside of the facility itself. There are a total of 12 injecting booths. As you'll see later, it's very, very busy. People come in, they can get safer injecting equipment here from nurses who stand at this nursing station, sterile syringes and other materials that help protect against HIV and hepatitis C transmission. Now, the nurses here are watching people who inject passively. You can see these mirrors. That allows the nurses to watch and intervene if someone nods off or overdoses. If there's anything you can take home tonight from my talk, it's that fatal overdose is 100% preventable. There have been millions of visits, thousands and thousands of overdoses. Never in its existence has there been a death in this facility. And that's because, as we learned from Dr. Wally, overdose can be reversed very easily with oxygen and naloxone as well. And so that's what the nurses are watching for and provide those services if that happens. So I have a video here, and I came late, so I couldn't test it, but I wanted to, I hope it works. Okay, great. This gives you an idea of the volume that they see through Insight, and then the manager, Darwin, talks about some of the other services that are provided.
When somebody comes to Insight and decides that they need to use the service, the first thing that happens is the staff is going to take them aside for a one-on-one conversation. And that's really important. We don't just throw paperwork at people. We talk to them about their drug use patterns, why they're here, why they need to use the site, and we tell them what the site can offer, and we make sure that they know that the site is for them. It's for their health care, it's an important social contact for people, it's an important place of respite. So after we've had that conversation, if they decide to sign up, we'll sign them up quickly and we'll give them a code name that they can use so they can use the site anonymously. After that, people can go into the wait room where they wait to get into the injection room, and there's staff there to chat with them, find out how they're doing, and make sure they feel comfortable in the site. They'll go into the IR, they'll be given a booth, they'll be shown the array of clean equipment that we have, which is broader than most needle exchanges can offer. We'll show them things like where the sinks are so they can wash their hands with some soap and water before they use. It's incredibly important, small things like that. They can talk to a nurse while they inject. They can learn safer injection techniques. They can see the nurse after they're done for some wound treatment if it's necessary. Then they can go grab a cup of coffee afterwards in the chill lounge or a cup of juice, and we can talk about some of the broader issues. We can talk about what it's like to live in the downtown east side. If this person's homeless, we can talk about housing. If this person needs methadone, we can get them in touch with that. If a person wants to talk about detox, we can tell them about on-site upstairs. Great site for people to go to where we can just look at them, treat them as human beings, treat them with respect, and say, what are your needs?
So there's a couple things I love about that video. First is Darwin's Canadian accent, which I miss. And I've tried to lose mine. And also the volume. You get a sense of how busy the facility is every day. Over 18,000 individuals have been registered since the facility opened in 2003. And the facility operates at full capacity, about 700 visits. Now, I wanted to note that only about 60% of those actually include use of the injection room, that IR that Darwin mentioned. Many people go to the site just to obtain supplies or to engage with basic medical care like wound care from the nurses who are there, or talk to peer counselors about entering into addiction treatment. In terms of medical intervention, there were over 1,700 overdose incidents in 2016. That's a tripling from the year before. They're really in the midst of a fentanyl crisis right now, just like we are. But again, no deaths in 2016 or ever. Over 4,500 clinical treatment interventions, often things like wound care or safer injecting education. Over 5,000 referrals to social and health services like housing, and over 400 referrals to on-site, that addiction treatment facility upstairs. So I'll talk now in 5 minutes or so about some of the results of our scientific evaluation. This was a very controversial facility when it opened in Canada, even though it's a very liberal place. There was a lot of concern. One of which would be what was termed the Honeypot Effect, that if you opened a facility like this, you would have people flood into the downtown East Side neighborhood and cause even more chaos and disorder than was already there. So the research team looked at this. Basically, they had research assistants go out 6 weeks before the facility opened and 12 weeks after at random times throughout the day, and we asked these students to count how many publicly discarded syringes they saw, how much injection-related litter they observed, and how many people they observed injecting in public, which is a huge challenge in the downtown east side. And what you can see, the opening of the facility is shown in the dotted line. After the facility opened, of course, usage of the service went up, and the amount of publicly discarded syringes, injection-related litter, and people injecting in public went down. So in contrast to this honeypot effect, these services actually support neighborhoods in which they're in, reduce people injecting in public, and really now are supported very much by the local business associations and neighbors in the downtown east side for this reason. I'll talk about now busting a couple of other myths from our evaluation. So in addition to the concern about increasing public disorder in the downtown east side, there were several others which we sought to investigate. So here's the citations here. I'm just going to go through the take-home points for you briefly. The first was that there was concern that perhaps opening an injection facility would encourage people to initiate injection drug use. So we actually had a cohort of street-involved and homeless youth in Vancouver being recruited and followed when Insight opened. And we were able to look to see whether the opening increased the rate of injection drug use initiation in that very high-risk cohort, and in fact, it did not. And in a separate study amongst the 1,000 people who were followed prospectively who used the facility, only one reported initiating injection drug use at Insight itself. Most clients have been injecting for a long time, 20, 30 years is pretty typical. There was another concern, and I get this a lot, that these kind of services enable drug use. And a very smart woman I talked to who's affiliated with SIF MA Now told me that if this enables life, then that's a good thing, right? But in addition, there were concerns that this would maybe prevent people from seeking employment. So we looked at this, and in fact, the opening of Insight had no adverse impact on folks using the facility seeking employment. Kind of along the lines with drug disorder, there was a concern that Insight would attract drug dealers to the area, and this is a common concern when these are being considered. So we worked with the Vancouver Police Department and analyzed crime-related statistics before and after Insight opened. And in fact, there was no difference in arrests or robberies before and after the facility opened, and a small decrease in vehicle-related crime. There was concern that in the community broadly, Insight would increase relapse rates if people were seeing, using the facility, that this could increase relapse into injection drug use. In a cohort of people who are injecting who've been followed since 1996, we looked at the rate of relapse before an Insight opened, and again, no difference. And I'll get to this just in a moment. There was a concern that these might increase rates of overdose, when in fact they do the opposite. I'll show that a bit later. This is a really important study that I want to highlight. It's published in 2011. The first author, Cora, here, was able to link people who use the facility with an addiction treatment database in Vancouver to show uptake of addiction treatment among people who use the facility. And so how to read this figure is if the dot is on this side of 1, that means that this variable was positively associated with uptake of addiction treatment. So what we found, or what these authors found, was that people who regularly use the SIF, and importantly, people who had contact with peer counselors who work in the facility, were 30 and 50% more likely to enter into addiction treatment than those people who did not. So in fact, people who use Insight have higher rates of treatment uptake than people who do not. This can serve very much as a pathway into addiction treatment. And this was published before buprenorphine was approved federally in Canada. So if we were to open one of these facilities now, I think we could even do a lot better than when some of these studies were published. So finally, just to start closing up here, I'll talk about the work that I was able to lead and published in the Lancet in 2011. We worked with the medical examiner's office to map at an address level detail where fatal overdoses were occurring in Vancouver. About a third of them occur in the downtown east side neighborhood, which is shown in the gray border here. The location of Insight is shown in the red dot right in the middle of that neighborhood. we basically calculated block-level overdose fatality rates. And the darker the color is, the higher the overdose rate in that city block. And this is the 18 months before, and this is the 18 months after the facility opened. Significant reductions in overdose mortality in the downtown east side after the facility opened. And in fact, this overall is a 35% reduction in overdose fatality compared to only a 9% reduction in the city of Vancouver overall. So again, observational evidence, but compelling, I think, that Insight and other facilities like this save lives and prevent overdose at a population level. So just to start summing up now, there has been a lot of discussion about supervised consumption facilities in Massachusetts. There's some incredible advocacy that's going on. I believe SIF-MA now is a co-sponsor of this event, which is great. There's a lot of controversy about where these would be, where they should be, and a lot of politics around this. I won't weigh in on that. We can maybe discuss that during the Q&A. But from a public health point of view, you want to put these facilities where there are neighborhoods with high rates of fatal overdose. And so this is from the Boston Globe, showing, unfortunately, high rates of overdose fatality across Massachusetts, as we've seen from the other presenters. These numbers are the number of overdose deaths per 100,000 people living in that town per year. And just to give you a baseline, Vancouver had an overdose fatality rate of 32 per 100,000 when it was declared a public health crisis, which led to the opening of Insight some years later. And so unfortunately now in Massachusetts, there are towns at or above that limit, that rate across the state. So something to consider. Just in summing up now, I wanted to offer and lead into our final presenter I'm looking forward to hearing from. Insight and supervised injection facilities provide a venue to pilot other harm reduction programs. They were the first, to my knowledge, in North America to distribute fentanyl test strips, which you'll hear about from Jess Tilley in a moment. So these are used at Insight to detect fentanyl contamination in illicit drugs and have been shown to decrease overdose rates among people who use them. So I will leave it at that and turn it over to the last presenter, and thank you again for having me this evening.